Infant gasping for air during sleep is a red flag that deserves attention. In babies and young children, snorting or gasping at night can be a sign of obstructive sleep apnea, where the airway narrows and breathing briefly stops. Some newborns have periodic breathing, short pauses with quick catch-up breaths that are usually harmless and fade by about 6 months. But gasping, color change, or long pauses are not typical and should be evaluated. If your baby seems to struggle to breathe, or has labored or gasping respirations, seek urgent medical care. Then, for airway-focused follow-up, call Dr. Bethaney Brenner at 860-673-7155 to schedule an evaluation in Burlington CT.